Good evening. Welcome to Left, Right and Centre. On the show tonight, as more cases of COVID-19 are identified in India, we look at the larger issue. Are we just weeks, if not days, from a community transmission scenario, which means that the source of infections will be difficult, if not impossible, to identify? Or should we rely exclusively on data provided by the government, which says that the death rate in India is tiny compared to the rest of the world, and non-specific testing of COVID-19 is not required? Not at all. That's what the government says so far. But we contrast that with what others are saying, experts are saying. On this program, we've got some of the finest in the world. But before we come to them and share with you what a lot of experts are saying based on what we've seen in China, in South Korea, in Italy and in Iran, and compare it with what we are doing in our country, let's bring you the top India developments as of today. The number of cases, the number of deaths have now across the world crossed 8,000. There are more than 2 lakh cases globally. Now, as far as the developments in India are concerned, the first case of an Indian army, let's bring that graphic back up. The first case of an Indian army soldier and 152 cases in India. The World Health Organization says India needs to test more for the spread in the community. In terms of what's happened in West Bengal, which had its first case yesterday, some lapses on the part of a senior IAS officer have been looked at by Mamata Banerjee. She is absolutely furious, and she says no VIP culture can exist. The rules are the same. If there has to be a quarantine, there has to be one. Many trains continue to be cancelled as a result of poor demand on many key rules. But let's just take a look at the next set of graphics, and this actually has to do with the India situation. Now, this is case by day, again at a time when the situation in China was very bad. There were many numbers where in India there wasn't a single case reported in a day. Now that changed, and it changed dramatically, because sometime in March, the beginning of March, as you can see, that line graph escalates very, very rapidly. And that is, in a sense, keeping with what we've seen in other countries of the world, where suddenly there is a rise in cases. However, it needs to be mentioned that the rise in cases in India, in terms of the overall numbers which have been officially declared, is nowhere close to what we've seen in many other countries. The question is this: are the numbers which are being reported now truly representative of the actual numbers out there? There is a sense that given the limited number of testing going on in India, that may not necessarily be the case. So what happened today was fairly interesting. A large number of CEOs and top bosses of startups in India decided that they wanted to approach the Prime Minister and the government of India with this appeal: the COVID-19 outbreak, India should impose strict lockdowns and Section 144 across major cities this week. Now, these individuals have based this appeal on what they've been reading from around the world. And the points that they are saying is that countries which have acted early and strongly are the countries which have done well. Undiagnosed cases typically are 5 to 20% of the diagnosed cases. India, therefore, could have as many as 2,500 cases presently, and not just the little more than 100 at this stage. While containment efforts should continue, imposing a lockdown and Section 144 is all important. Now, countries which have acted early and strongly are performing much better than those which did not. If you look at the bar chart, if you look at the chart on the left-hand side, you can see the exponential rise in the curves in many countries which are not doing well, and compare that with the flattening curve on the right-hand side of South Korea and increasingly China, Thailand, Singapore and Japan, which appear to have made a lot of progress in fighting off the progress of the infection itself. Now, this is actually a very, very important graphic. Now, this is the Wuhan situation, and what it actually says is that if you look at the gray numbers, and the gray numbers are what are called the true cases, the cases which may be out there but have not been detected through any official mechanism. And then the gold numbers which start appearing in the middle are the numbers of those who have been officially tested. As you can see, in the initial phase, the number of people who are undetected but have symptoms of COVID-19 is much, much larger in Wuhan compared to the numbers of cases which have officially been diagnosed. But that number of true cases, as they are known, comes down dramatically in a certain date in March in the city of Wuhan when the city goes into lockdown. The point is this: the moment you start a lockdown, the number of these true cases which have not been officially diagnosed but are still out there goes down dramatically, while you get a realistic number of the actual cases out there. Those actual cases are the ones in gold that you can see on the bars on the right hand side. Which is why a lot of people actually say, look, let's have actual testing which takes place. So has India done a good job or has India done a bad job? Let's be very clear about this. There is a lot which India has done which is positive. So what is it that India has done which is positive? Let's bring up that last graphic one more time and then look at what some of the suggestions are. We've had travel restrictions, we've had testing of international passengers, the temporary shutdown of schools, colleges, cinemas, gyms. We've encouraged citizens to self-quarantine and work from home. That is all important and that is absolutely critical. What India needs to do is that we need to ensure that there is a delay in moving to this community transmission stage. What is community transmission? Community transmission is the next stage when it becomes virtually impossible to actually to know the source of the infection, because it's spread into the community. It's not like contact tracing now, where a person comes in, they are detected, their family is quarantined, they're told stay at home while the COVID-19 patient is put into a hospital for better care and then subsequently released when they are better. That's not happened in India just yet in terms of the larger effort at shutdown. So joining us now to look at all of this, we've got Dr. Sanjeev Bagaid, Senior Consultant and Pediatrician at the Nephron Clinics, T. Sundaram, Global Coordinator of the People Health Movement, Dr. Anil Handu, the Director of Pathology at the Nanavati Hospital, Mekin Maheshwari, he works at Udhyam.org. He's looked very, very closely at the situation. Arvind Kumar, the Chairman of the Center for Chest Surgery at Sir Gangaram Hospital. And later on in the program, we'll be joined by the Silicon Valley entrepreneur Tomas Puello, whose writings on COVID-19 have gone viral millions of times. They've been shared across Twitter and the internet. And also Arnaud Bernat, the Head of Health and Healthcare at the World Economic Forum. Let me go across to Dr. Arvind Kumar first. Dr. Kumar, thanks very much for being with us. We are still relying on what some people would say is a guesstimate, that look, on the basis of the samples which we have tested so far, there are no cases which have been reported, and therefore we don't need to go in for a mass-based test system. On the other hand, if you look at the example of China and Wuhan, it was only once they started testing to a broader number of citizens that they got a pure, correct idea. In your mind, do we need to be testing more?
Yeah, I totally agree with you that the number of cases that we are detecting is not a true representation of the viral case load in our society. I think there is a huge load of either asymptomatic patients or even symptomatic patients but not diagnosed with corona, who are out there in the society. They are unrecognized, undiagnosed, nonetheless they are there. Many of them are getting cured on their own, nonetheless they are spreading the infection. And I think it's my fear that somewhere under the surface this case load volume is slowly increasing in the society. And I'll give you the reasons. If we trace our numbers for the last 1 month, starting from 1 or 2 occasional cases reported here and there, Every day the number is increasing, and today we've crossed 150. But this is just the tip of the iceberg. I think there is a big case load which is undetected, unrecognized, which is there. And my biggest fear is that maybe somewhere it will reach a critical mass in some part of the country, and then suddenly explode, and we'll have a large number of cases there, which is what you referred to as stage 3, where it's a community transmission, after which it becomes uncontrollable.
Right. Dr. Bagai, do you believe that a lockdown is imperative?
Yes and no. Thank you for having me on your show. Yes, in the sense that lockdown can also be a self-regulatory quarantine of on need-based basis to step out of the house. A formal lockdown in which a complete city comes to a standstill, probably not just yet. Now we know that the figures which you have shown represent a particular value as a percentage, but whatever value we calculate in a large cohort group like India, in early days doesn't actually truly reflect a percentage, because if your denominator is very small, your numerator can actually change the graphics very quickly. So unless until you don't have a critical mass in your statistical evaluation, you don't get a p-value which is accurate to depict. So I think a more true value, because the testing has now become more frequent and more aggressive, you will get a more fair value in the next week or so. Testing, yes, we need to do a more amount of testing. We need to continue our surveillance. We need to continue the containment policy. That is extremely important. And the most important thing is what we are doing right now is public awareness. I keep saying this over and over again. It's more like a cliche now. It's the most important thing is public awareness.
Right. Dr. Anil Handu, another aspect of all of this, in order to prevent a shift to stage 3, is we have this situation in our country where even today you'd had a group of people who were supposed to be in home quarantine. They'd been stamped on their wrist saying that you have to be in home quarantine, deciding not to be in home quarantine, board a train and then be forced off that train when they were noticed. Isn't that the real danger, that you've got people who just don't care?
Thanks, Vishnu, for having me on your show. It's really, really unfortunate that people are actually taking it so casually. The point is that the offices have been locked down, or the schools have been locked down, or every other place which has been locked down is primarily for the fact that they want to make sure that the people are going to be sitting home and making sure that they don't infect further people. But some irresponsible people in the system just do not want to follow the dictate. And therefore, that is eventually going to lead to a lot of infection in the community as well. And I agree with you completely that this really, really needs to be enforced by people themselves. They need to be understanding that they have to take a call of getting better, ensuring that they are going to be in their systems, in their respective homes, and not creating a situation where people are getting infected right, left, and center.
All right. Mekin Maheshwari, at this juncture, what is your biggest concern in terms of how we have been dealing with this crisis? What is your biggest concern?
I think my biggest concern is that we don't have data and we're probably flying blind. So we don't have data about what might be the extent of undiagnosed. I think government has had people be in self-quarantine, but like you just talked about, that self-quarantine may not necessarily be strict enough. So to be able to take measures for the government, I think India is too large a country to lock down completely. But for figuring out which areas should we be locking down aggressively, for figuring out where should we be doing a lot more testing, we need data. So based on data, based on patterns that we see emerging, where are we seeing threats of community transmission? So there are independent folks who are working hard to try and figure out contact trails. I wish that was something that government could share in an anonymized fashion. South Korea did that, Singapore did that, Taiwan did that, and all of that made a huge difference in terms of how these countries were able to contain it.
Okay.
Just access to this data would enable people to take measures. I do agree that we are in a tricky situation because we don't want to panic. Panic can probably be as dangerous as the virus itself. But at the same time, we need people to take this seriously. And I feel like media can do a big job in ensuring and carrying this delicate message.
So I take your point, Mekin. Mekin, I take your point, and I want to go back to Dr. Bagai on this. You know, the sense is that if we test more, there'll be mass panic. You know, I don't really see very much panic right now. There is obviously anxiety in the airport when people try and come in. But where is there a sense of mass panic? And, you know, if testing is to take place, it's not as if everybody would rush to get tested. It would only be those individuals who have symptoms, and they would go to private facilities. Perhaps in some cases they may even be willing to pay for those services. Wouldn't that be beneficial simply because the government facilities which exist are already overburdened? And there are already lines, for example, in Delhi and Ram Manohar Lohia, which are very long lines. And that is exactly where you can end up getting the infection. So you go to see if you have the infection, you may not have it, you stand in that line in front of that hospital and end up getting it there. So therefore, doesn't it make sense to actually encourage private companies, agencies, whatever it is, to do this on a more proactive basis? Why are we only now starting the process of talking to them or engaging them? Okay.
I think just yesterday the ICMR press conference has already given the direction that there would be a total of 121 laboratories by end of this week for the testing, and approximately out of which 50 or 55 or 60 would be accredited, NABL accredited private laboratories. I must add the testing, although it must increase so that we have a critical mass to analyze, it must be rationalized, and only those patients who you actually feel require the test. Now, at large, in a large country like India, random testing of anyone and everyone, the entire country or entire city
that makes
or
no
entire
sense.
community is virtually impossible.
Yes.
Right?
Completely.
The second point
yes.
which I want to make is, which I said in my opening remarks was, that at the present moment we have a data of few weeks since we started testing. We will reach a very good number of tests by sometimes around next week. Now there is enough evidence available in the international market that we need to do through technology, through digital technology, simulation studies based on AI, which can actually help you in the contact tracing, can give you the hot pockets, can tell you which are the potential super carriers, and take preemptive action. Now, if you try to see the data in a disjointed manner, the data is not going to give you any information. So, if we have a pan-India AI model, the models are available internationally. They are being used at the present moment. The simulation studies. You can actually identify the hot spots and focus more on the contact tracing there. So, what really I'm trying to say is, you'll rationalize your resources in a more smart and optimum manner to actually tap what you need to tap and quickly intervene.
Okay. Dr. Kumar, a lot of people would say that one of the biggest concerns is those who may be carrying the virus but don't show symptoms themselves. In a situation like this, is there anything which any state government or any government can actually do? I mean, how do you really know who has it if they don't show symptoms?
I actually said it in the beginning also, that my biggest fear is that there are large number of people out there in the community who are carrying the virus. They may just be in the incubation period, likely to show up symptoms few days later, or maybe having mild symptoms which is misdiagnosed as common flu. They're not tested. And these people are infecting other people who are then infecting other people. So I guess there is an infection which is simmering under the surface. And I think this was the phase that Italy went through up till about 2 weeks back, when it reached a critical mass and then it exploded like a big bomb. And see what is happening today. that people more than 80 years are even being denied treatment because hospitals are flooded. And my biggest fear is in a country of India's population, India's population density, and the kind of facilities we have in the peripheral parts of the country, if this was to happen, the consequences will be disastrous. So I as a doctor would rather little bit overreact to the situation and enforce a very, very major, I may avoid using the word complete lockdown, but I would say that but for essential services, rest of the things, I for one would be in favor of just closing everything for the next 2 weeks, because you need to break this cycle of human to human transmission. Testing will tell you what is the load, but testing is not going to prevent the transmission. We need to prevent the transmission, which can only be done by what I called PDDP approach. PD stands for physical distance and DP is digital proximity. So we remain in touch with each other digital media wise, but we maintain a physical distance so that if I'm infected, I don't infect others. If others are infected, I don't get infection. I very strongly feel that the time has come now that we start enforcing these measures, even if they are too much, they appear to be too much today. I think too much today and preventing India from going into stage 3 next week or next to next week is more important and probably better than being a little bit complacent today and then having the country go through stage 4, the consequences of which will be disastrous. See what is happening in Italy. If a country of Italy's small size and their health infrastructure is reaching a stage of denying care to 80 plus people, what would happen in our country? It's a very serious situation, and I definitely don't want to see our country going into that serious situation. It may sound a little exaggerated response, but I think it's better to overreact and avoid stage 3 coming to India than underreact and face stage 3 10 days later in India. Next 15 days are the most crucial for our country, and I think it's a golden opportunity, window of opportunity, where by strict measures, if we break the transmission cycle, we could have prevented our country from going from stage 2, where we are today, to stage 3.
Okay, those are very, very strong words, and I'm so glad that you've actually spoken out in this manner with your views. Dr. Handu, again, there is a lot of things being said about what does the lockdown mean? Is it the end of the world? What's going to happen to us? Whereas if you actually look at the steps which various state governments have already taken, which are fairly sensible steps. Let's look at what has happened in Gurgaon today. Malls have been shut, cinemas, swimming pools have been shut as well, bars have been shut, restaurants have been kept open as long as they are small restaurants with lower capacity, but grocery shops are open and supermarkets are open as well. All that needs to be added to this is people are told, look, just stay in your home, work out of your home, don't come out, and if you need to go to the bazaar, to these shops, then please go. So it's not going to be anything more than that. Is that correct?
Absolutely correct. And I think Dr. Kumar just nailed it completely when he very clearly said that, it is the responsibility of all of us, all of the people across the country who have to take the onus on themselves and start believing in the fact that this disease is for real and we need to take action. How do we take action? Be home. And if it is required that you need to go out and just get groceries and other stuff, it's available there and you can go out and get that. But just not have social gatherings, just not meet each other so much. It is just a matter of 2 weeks or maybe 4 weeks when we will probably hopefully be again in a situation where we'll meet each other. Having said this, we also have a lot of people in our system who do not want to believe that they need to take these precautions because they think they are never going to get it. But it's a sad thing that people are looking at it that way. My sincere suggestion and my sincere request to everybody across the country is please take care of yourselves, please take care of everyone around you, keep a safe distance, and we will all fight it well.
Okay.
Otherwise, we'll all be doomed.
Mekin, one question to you as we wrap up this part of the program, which is this. What have we done right in this country? A lot of people would say evacuations of Indians outside, we've done right. We really tried to sort out people coming from outside the country. Do you believe we've done a lot of good stuff in certain areas?
Absolutely. I think compared to almost all of Europe, we acted much faster. Right? We may have been behind countries like Israel or Singapore, but compared to Europe, which is going through a very, very sad state today, we acted well in advance. And thankfully, relative to them, we are doing much better. The challenge with the virus is that it's exponential in nature. And the challenge with most exponential things is that they are visible only in hindsight, easily to us, because most of our minds work linearly. I used to run technology at Flipkart to understand a little bit of exponential growth. And that piece, what will be visible to us, as Dr. Kumar said, like a week from today, like 2 weeks back, the Italians were in bars as well. Right. And they were partying, they were in restaurants without necessarily understanding what's going to hit them. I hope and pray that it doesn't hit us, but nothing so far tells us that it won't. People were talking about summer. Look at Malaysia's numbers today. Right? Malaysia has added 150 cases today. They're at 650. Right? So, like almost all of Southeast. So, Indonesia, Philippines are also going through a large number of cases. And the problem with the disease is that almost 80% people don't show symptoms and they recover. They're completely fine. Right? Yep. It is the 20% that need care, and anywhere between 5 to 10%. In Italy's case, the death rate is proving to be as high as 6.5–7% of those infected.
Yeah, and that's an average. If you go up the age curve, then it becomes substantially more.
49%.
Yeah, no, absolutely. I'm going to take a short break at this stage. I'm going to come back with more on this program. We're also going to be joined by Tomas Puello, the Silicon Valley entrepreneur whose writings on this have gone completely viral all over the world, being shared millions of times. We're going to play out some of that data which actually comes from his work. Stay tuned. Welcome back. We're looking at the COVID-19 virus all over the world, and we're also trying to understand what are some of the best steps forward for India as we deal with this health crisis. In a few moments, I'll be joined by Arno Bernard, the head of health and healthcare at the World Economic Forum. I'll also be joined by Tomas Puello, the Silicon Valley entrepreneur whose writings have been phenomenal. In fact, this particular graphic that you see on your screen comes from Tomas Puello and his detailed research in this issue. And I think we need to look at it one more time before we go across to Tomas. Let's bring that up full screen so that I can explain to our viewers what it is that they're looking at. These are learnings from Wuhan in China that show that there are actual undiagnosed number of cases that are between 5 and 20 times the number of diagnosed cases. The point being this: if you have a number of diagnosed cases, that's not the actual number. The actual number could be much larger. In the case of China, it was between 5 and 20 times the number of diagnosed cases. So if you look at the bars, which are in gray in color on the right hand side of the screen, you see the gray bars going up, 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 up. And these bars are actually of undiagnosed cases. These are individuals who've displayed symptoms, but they've not gone for a test, or even if they've tested, they've not been tested as COVID positive, but in fact they were COVID patients and they suffered the symptoms. Many of them would have lost their lives. But it's only afterwards that you see the gold colored bars start rising. The gold colored bars that you see, and that keeps going up, is the actual number of cases who were tested. These are called diagnosed cases. But the point is, when did China start getting a grip on the actual numbers of people they were dealing with? when they went into a lockdown, and that takes place on a particular date. And immediately after that, the number of undiagnosed cases starts dropping, and the number of cases which are diagnosed starts rising. Why? Because people have an actual number an actual idea of the numbers that they're dealing with, so that at the end of the day, people who are sick actually are treated, and once the lockdown starts, then social distancing works out as well. People don't come into contact and people are not infected. So if this number of China of 5 to 20 times is the number, which 20 times the number of people diagnosed are undiagnosed cases, then let's think about what the situation in India may be. I'm joined now by Thomas Pueo and Arnaud Bernard. Thank you both very much for being with us. Thomas, your work has been absolutely fantastic. Is this the big worry, that there are a large number of cases in a country like India which are undiagnosed, and therefore when we report just 3 deaths or 4 deaths, which we are doing at this stage, we are deluding ourselves?
Yes, absolutely. Just one very small clarification before that chart. I analyzed it, but it doesn't come from me. It comes from a couple of researchers, Wu and Jennifer McCougan, and everything that I did in my post is like that. It's an analysis, research, data from other people that I put together in one place. But your point is exactly correct. There's a very big lag between official cases and true cases. And when somebody has come to a hospital, is being diagnosed, that means that there's hundreds more that are outside that have not been diagnosed yet. It depends on how well the country is testing for the spread and many other things. Right now you have 3 deaths, and 3 deaths is a telltale that there are many more than the 100 or so cases that we see today in China. And we can do a quick rule of thumb there to understand what the true cases are. If you have 3 deaths today, usually these people take around 3 weeks to die, meaning that they were infected 3 weeks ago. If they were infected 3 weeks ago, but only 1% of them dies, it means that 3 weeks ago there were not 3 people, there were 300 people infected. And if there were 300 people infected 3 weeks ago, now 3 weeks have passed, and this has time to grow. Usually this grows around doubling every week. So it has doubled 3 times, meaning that it has multiplied by 8. If you had 300 cases 3 weeks ago, you might well have 2,500 cases now. So the point here is, we don't know how many cases there are, right, but we're very confident that it's more than the 100 that you have officially today.
Right. Arnaud Bernard, thank you very much for being with us, Head of Health and Healthcare at the World Economic Forum. In India, what the government is doing is that they are taking samples, approximately 20 odd samples from 50 odd areas, and each of these samples are from, in many cases, ICUs of those with respiratory distress. This is one of the most common symptoms, and then they are testing these. Now, as of yesterday, they'd done 500 tests, and of those 500 tests, there was not a single case of anyone being COVID-19. Now, there are 500 more tests they've done. We don't know the results of that as yet. So, Mr. Bernard, my question is this. Does this work as a methodology, what we are following in India? Does it make sense that, look, let's not be hyper about testing. The tests we've done so far is a large sample size, and it indicates that things are under control. So why frighten people? Does that logic make sense to you?
Well, it's I think it's all a function of the stage of the disease and the contamination you are in. I mean, testing strategies vary widely depending on those very stages. I think obviously when you start seeing a number of deaths, and if it's going to happen in a relatively close community, the best practice would probably be like in a ship off the shores of Japan, to actually test pretty much everyone, or in the case of a small city in Italy that is under containment, you need to test everyone because you want to see that your containment measures are going to improve, and you need a baseline, right? So that's one part of the answer. Now, at some point in time, you are going to also try and find those cases with a view to break contamination chains. So actually doing the testing in the close proximity of the ones that have been affected by the disease is certainly very helpful when your strategy is still about containing the spread. Now, there is obviously a theory that at some point in time you're going to move into a phase where there is no way on earth you can get back patient zero of various clusters. At that point in time, the containment strategy and confinement strategies are the ones to be applied. In that context, other than for statistical evidence of the measure of the efficacy of your containment measures, you can make an argument that you'd better spend your time and resources and money on strengthening your health system and buying PPEs for your healthcare workers and be less paranoid about saturating your labs and getting DNA extraction kits that are in short supply. At that point in time, you may want to make an argument that you are going to test only those guys that you know have a high likelihood to end up in the ICU, because you want to pose a diagnosis in view of providing for the best treatment. So depending on the very phases, I think you will have very, very different strategies.
Okay. Thomas, when one speaks about a lockdown and you look at what China did in Wuhan, now that's in the case of a country like India, it's just not possible. We are a large democracy. We don't work on the basis of lockdowns. We've never had that sort of rigidity in our system. What is the minimum that India should be doing now to prevent moving to stage 3 of this virus, community transmission? What's the minimum we need to be doing?
So I think a commentary first on the democracy, because one thing that everybody says is, oh, China was able to do this containment because it's more of an authoritarian regime. But on one side you have Japan, that is a democracy, right? Taiwan is a democracy, Hong Kong similarly. So even if it's inside of China, so you have all these countries that were able to contain this and were democracies. And then you have countries like Italy, Spain, or France, which are also democracies and also have the power to create very heavy lockdowns. So I don't think this is a question of authoritarian versus democratic regimes. Everybody can do this. It's a matter of will. Now, the question that you also ask is, what are the right measures? And the answer is, we're not sure. But here's the thing. The current transmission rate is around 2.5. What does it mean? What does that mean? It means that every person that gets infected infects 2.5 other people. You can imagine that explodes over time. The goal here is, we don't understand the situation. We don't know how many cases there are. Our healthcare system is not ready. We need to get that down as fast as possible, as quickly as possible, so that we stop the spread for some time. We understand the situation, and then we can go back and release some measures. So now, finally answering your question, what measures should we take?
Yeah.
It should be a set of measures that is aggressive enough to buy us time, to give us a good understanding of the situation. What does it mean? It means probably things like definitely quarantining all the people who are suspected of being sick. It means probably closing schools and universities. It definitely means limiting the number of people who can gather at any given time. It means everybody who can work from home should work from home. This is the minimum. And then from there, you can decide if you want to be more aggressive than that. And I think that is the hard decision that politicians need to make today. Is like, how much do they want to take risks? If they want to take risks, they're not going to take too many measures, and they could see this exploding like in Italy or Iran. Or they might say, you know what? We have very little time. It's very precious. Let's just be a bit more aggressive today. Let's have more measures to lower the transmission rate so that we buy ourselves a few weeks of time to understand the system and get better prepared for the epidemic.
Yeah. Mr. Bennett, what are some of your thoughts about the road ahead? Do you believe, again, in countries like India, that it's just a matter of time before we enter stage 3, which is community transmission, or can we actually avoid stage 3 altogether? Are the steps that we are taking now, if we improve on these steps, can we prevent getting to stage 3, or is stage 3 inevitable irrespective of what we do now?
I tend to agree with what has been said before. I think it's all about speed and the testing strategies, and we have not seen, with the possible exception of South Korea, but we have not seen strategies being effective at actually permanently breaking down the contamination chains. Okay, at some point in time, this thing gets into fire and we lose control at some point. What we have seen is some governments implementing confinement measures like the ones that have been described, maybe a little too late. From time to time, it's a matter of 3, 4, 5 days, but the doubling rate is 72 hours. So it makes a huge difference. Making a decision 3 days before makes a huge difference. 6 days before is an enormous difference. A week before is an enormous difference. I think we have seen that those governments that have been taking very courageous confinement measures, including are the ones to share with the public opinions, are the ones that have so far seen the crisis better managed.
Yeah, no, lots of key points over there. I think the common message from both of you is, look, you have to act now because now's the time. You can't delay the entire process. The situation is evolving over here. The government is trying to do what it sees to be the right move, but there's a lot of data everywhere at this stage. It's a question of taking the right choice. It's that choice which is going to change and it's going to save lives. I'd like to thank both of you very, very much for joining us. We're going to continue with our focus on COVID-19. Maharashtra has seen a jump in cases. We have this report.
4 passengers deboarded from coach at Maharashtra's Palghar station from the Garib Rath train after co-passengers raised alarm on seeing a stamp on their hands saying home quarantine. This is what the government feared, people not obeying advice of home quarantine.
उनके ऊपर मॉनिटरिंग भी किया जाता है, उनके ऊपर कंटिन्यूसली ध्यान रखा जाता है कि वो घर पे है क्या नहीं, उनको कॉन्टैक्ट्स किया जाता है। और इतना ही नहीं, अगर ऐसे ही बाहर निकलते हैं, डिसोबे करते हैं, तो मुझे लगता है कि पब्लिक को भी ये समझे कि भाई ही शुड बी इन एट होम, और अब वो फिर भी घूम रहा है, तो मुझे लगता है पब्लिक को भी अवेयरनेस हो, इसलिए उनके हाथों के ऊपर एक स्टैंप लगाने का काम किया।
With a little over 40 as the latest figures, Maharashtra continues to record the highest number of COVID cases in the country. But the government says most of these cases have travelled abroad, about 50% of them, with the very first case detected on March 9 of a Pune couple who had gone to Dubai. They have then infected 10 more. The highest number of cases are in Pune, Pimpri Chinchwad with 18, followed by Mumbai, 7. Right now, COVID is in stage 2. The government says there is no need to panic as the community is not infected. So what is the government doing to combat it? Healthcare facilities are being expanded. Along with Kasturba in Mumbai, KM Hospital will also be available for testing. More 8 testing labs will be installed across the state, where currently there is only 1 in Mumbai and the NIV. Machines are expected to arrive in 10 days to take testing capacity from 100 samples a day to 250 a day. But people are resorting to panic buying as they fear there could be a lockdown in coming days. At this point, the government has shut down malls, schools, colleges, cinema halls, parks and other recreational places. The government believes and has appealed to people that if it is not necessary, they should not go out. At the Parel station, the crowd is drastically reduced, and this is the commercial hub of Mumbai. The government believes that this is necessary to fight coronavirus. In Mumbai, with camera person Sanjay Mandal and Rajendra Thale, this is Purva Chitnis for NDTV.